Hi, everybody. This is Gigi from Wellness on Wheels. Welcome back to our featured guest appearance. And I'm honored this week to have my dear friend Chris Paulson, who is a psychotherapist here in Los Angeles, as well as the state of Washington. And Chris has been working with my team for quite a while. We've had some interesting, challenging cases together. He has over 10 years of experience in this world of addiction and mental health. And he recently opened a 40-bed residential treatment facility in the state of Washington. And as we know, things are really very difficult for us right now in this world of mental health, Chris. So I want you to start by telling us a little bit about yourself and how you've handled this lockdown in your practice for the last few months. It must have been really, really hard.
Yeah, I mean, that's, with all due respect, an understatement. The world's upside down.
Yeah.
I can speak for myself and colleagues as well. I mean, related to the lockdown, it's challenging because so much of psychotherapy is about the relationship and the relational aspect. The idea is the room is a container, and within that container, a lot of emotions come out and the processing of past traumas or adverse childhood experiences. So to all of a sudden have an outside governmental body say, hey, you got to stay at home, it's jarring, not just for the professional, but also for the clients. You know, the clients oftentimes rely and depend on, well, I don't like the word depend, but the relationship is important. There's almost a sacred bond shared between therapist and client. So, you know, I think a lot of it is normalizing their anxiety and even honoring the own difficulties that we or I have faced as a professional. You know, I'm not a huge proponent of self-disclosure, but I think it's appropriate to tell a client, you know, this is weird for me. You know, I'm so used to you sitting on the couch and me in my chair, and here I am in, you know, a home art studio. You know, there's variability, but letting it be known that the client is not alone. There's a therapeutic factor or benefit in the normalization of an experience. And what I'll tell you is it has been challenging. You know, I personally, maybe I'm old fashioned, but I'm not a huge fan of technology. Even our interview right now, I'm just, you know, there's something about it that's a little bit disconcerting. And I think it's amazing that we're able to connect in this manner.
Right.
And what I'll also say is, in the past, I've done phone sessions, and I would always take a video chat over a phone session. It's not quite the same thing as in person, but it's better than nothing.
Well, what about like people who are having some serious issues already with mental health and addiction? And I know the social isolation must have been and has been very difficult on them. What are some serious things that you're noticing now in comparison to before when you had them in your bubble face to face? I mean,
Yeah.
I can't imagine for the average person like myself, but for someone who has some serious issues, like the cases that we've worked on, but even if you can just give us some examples, what are some things that you're seeing that are really kind of grave?
This will sound like a generalization, but I feel comfortable making it. And it's that one of the characteristics of addiction is isolation. So when an individual is in recovery and then all of a sudden they're forced to quarantine or isolate, there's an emotional familiarity to that negative state of being. And the reason why isolation is so dominant within the realm of addiction is because even if I'm functioning as an addict, I have to keep that part of myself hidden, and that's lonely. So much of the modern beliefs about the treatment of addiction are surrounded by the idea of connection. Connection is the opposite of addiction. We need community and we need support. So what's happening for people that are both in the midst of addiction or that are in recovery is that they're put into situations and environment where it's seemingly impossible to connect. And the isolation is familiar and it's negative. So all of a sudden, other negative emotions start cropping up. You know, there's pervasive feelings of loneliness, depression, anxiety, hopelessness, and it's extremely difficult to navigate. And I'll tell you, and this is from experience, but even my non-addicted patients report that I'm uncomfortable. I miss work. I miss my friends. I miss my family. Everything that I'm not going to say took for granted, but things that were a part of our day-to-day life and meant something to us are no longer an option. You know, even the coffee shop, you know, I go there in the morning and I see my friend who works there and, hey, how's it going? That's not possible anymore.
Right. So what about like for the average, like you said, the average person, because that's going to be the average population that we're dealing with.
Mhm.
And we have these fears and anxieties about, you know, like you said, our isolation, loss of jobs, loss of income, you know, our separation from our families. And there's a lot of issues now about like anxiety and decision anxiety, as I've heard the term, you know, okay, I don't know what to do. I don't know how to deal with my life now. How do I go out and step out in the world and make the right decisions? Are you helping people navigate these anxieties and, you know, and isolation issues? Because I don't know if we're going to see, and maybe you can tell us if you think we're going to see another surge in the level of addiction through anti-anxiety meds and things like that. I mean, there's some serious issues out there that I don't think our system is ready to handle, right?
Well, you just asked so many poignant questions. I mean, we have the anxiety of making decisions. We have the possibility of increases in addiction. I mean, so I'm going to try and navigate a little bit of that. It's interesting. A lot of the conflict that I see tends to arise within relationships. Relationships can be very polarizing, and one member of the relationship thinks, I need to be out, I need to be with my family. The other member says, it's not safe, we can't do that. And then there's conflict at home.
Mm-hmm.
There's also, as you previously stated, this anxiety about not only making a decision, but making the wrong decision. So people find themselves in situations where they're constantly thinking, what if? What if I go see my elderly parents and they get sick and it's my fault? What if my job says I need to come back to work? I don't want to because I don't feel safe and I lose it. I mean, it's a climate of anxiety. And a big part of that is because, and I'll try not to be, well, I'm not going to be political, but what I'll say is, I don't think there's a real handle on what is going on. We know what some of the goals are, but then we see over here that numbers are increasing, and it's a big unknown. And I will say this with certainty, one of the biggest triggers I've ever seen for either addicts or normal clients is the unknown, not knowing what's going to happen. It stirs up fear, because I think as a species or just collectively, we want to have some semblance of control in our lives. And the unknown is synonymous with being out of control. You know, I want to know how this is going to end, but I don't.
So how do you help people navigate that process? So, you know, if someone comes to you and says all these different issues are affecting my life, and whether they're already in the addiction recovery system, or they could be on that borderline of potentially using substances to help kind of calm them down. I mean, how do you get somebody on like a even keel to where they're not that anxious? I know this is a big subject, but
Oh, of course.
because you can feel the anxiety in the air even when you go outside, even when you're around your friends. So how do you pull back and kind of regain and stabilize yourself emotionally? If you gave us like one pearl of wisdom so that we can carry that out in our world.
I mean, I think there's actually a couple of things that we know can help. The first, and it's a term they use a lot in DBT, but it's pretty much it's wisdom at this point, but it's mindfulness. It's present time awareness, and the way people can develop that is either through meditation or breathing, or I mean, there's applications on the phones that help with this stuff. But the idea is that if I can ground myself, if I can be here now, there isn't, in the present moment, there isn't space for fear or anxiety, because it happens now and right here, right now. It's it's you and I, we're talking, we're on the computer. There isn't any other concern, and it's much easier said than done, but it's a practice, and it's easily accessible. People will always say, well, I can't meditate, I can't sit still. Just try.
Right.
Just
Yeah.
try. Try for 2 minutes.
Yeah.
So that's the first thing, is sort of the present time awareness. Another one is really navigating the fear itself. Is it that you're afraid to go outside, or you're afraid to see people? If you get into the specific and the causes and the conditions, I think people can identify compromises. And all I mean by that is, if I'm afraid to go to the grocery store, I don't need to go to the grocery store, but I can still go outside and walk, and I can practice all the suggestions. And if I need to, I can cross the street if I see somebody else. I will tell you that, and this is even from before the quarantine, that physical activity is one of the most curative things we have. Movement and blood flow, it tires us out, it releases endorphin and other mood and mind altering neurotransmitters.
Right.
And I think that because people are at home, and because people have no separation between work and life and space and this and that, it's very jarring. We've lost our routines. So that would be the third thing I would suggest, is develop a routine and stick to it. Human beings need and crave consistency. And I'm not trying to sound like an anthropologist, but I imagine when we were living in caves, we probably got up when the sun came up, did our stuff, and got back to the cave when the sun went down.
Now we're stuck in this cave, and we're kind of isolated with a whole different routine that maybe is not something that we really like.
Well, and that's a little bit of what I mean. Like, and I'll share about myself. When this first started, I set up a little home office, and I would sit in here till 9 o'clock at night, and then I'd go to sleep and wake up in the morning and come back in. And it was pointed out to me that, like, no, you probably need to carve out a specified time when you work, and a time for lunch, and a time when you exercise,
Right.
even if it's at home.
Right.
Because that kind of structure creates internal containment. And I think what's happening with the anxiety is, because everything's unknown, there's no telling of like when it's going to end or what's going to happen. So we're kind of just blown out into all these different realms of what if. And what we have to do is kind of find our center and reorient ourselves.
Right. Now, getting back to some of these people who you've worked with for years, who are in recovery or experiencing some serious issues, and those who might be on the edge and then go over the edge, what do you see as in terms of, like, our mental health system handling these kinds of situations? I mean, I'm sure we're going to see a surge.
Yeah.
I'm sure you and your colleagues know more about that than we do, but just being a layperson in this field of healthcare in general, we can't even accommodate our general, medical system needs, no less our mental health needs that have been really, over the years, cut down in terms of resources. Do you feel like that our mental health system is equipped to handle this possible increase in demand? And what are some of the resources that are out there for people, and when the system does slowly open up?
That, it's a bit of a loaded question. And I'm not, what I mean by that is, I don't think we're equipped. I don't think we're ready to handle what's coming. And I don't think we've even seen the worst of it, because everyone's isolated. No one really knows what each other are doing.
Right.
And you mentioned anxiety medications and, alcohol. I think that people are looking for ways to cope, and they're looking for ways to anesthetize and dull or numb pain and fear. And drugs do that exceptionally well. The other thing is, we're in the midst of a historical moment. what's happening right now has never happened. And I think there's an indication that this will become a collective, if not global, trauma. And so we're talking about anxiety, we're talking about substance use, but we might also have to consider PTSD, post-traumatic stress disorder.
Wow. Okay.
And that comes from losing a job. It comes from being constantly aroused and fearful. I've had people talk about nightmares. I've had people experience loss because of this, not just loss of revenue, but I know people who've passed. And all of these things hit us from different angles, but it all affects our sense of safety. So when things open up, we have a population that's been traumatized, that's, maybe addicted, and there just aren't enough resources. I'm saying that objectively. There's not enough drug treatment that's accessible to those that don't have the means to pay for it. There aren't enough free or low-cost clinics, and they're already inundated before all this happened. I used to work in the nonprofit sector, and I don't say this as a judgment to the agency I worked for, but for someone without private insurance to seek treatment there, they would be on a wait list for approximately 4 months. And
I'm sure a lot of people have lost their insurance now that they've lost their jobs.
yeah,
It's not going to be a pretty place for us to step back into in the healthcare system and in the management of it. And I know your facility in the state of Washington is probably going to really fill up quick, but it's every state is different in terms of how they handle the coverage for mental health. And we know that California and many other states have put that on the back burner. And that's why we have such a great deal of homelessness out there.
yeah.
I've worked in mental health for many, many years as well when I started my career. So I saw the shift in the beginning of homelessness with the deinstitutionalization. And so it was really sad for me to see the growth in homelessness and experience mental health in my community and friends, and now even so with people who are experiencing these issues. But I really, appreciate your input about this, Chris. I know it's really hard for you to get back in your practice and open up your office again, and you're probably nervous about being in the same room with somebody. It is more of an essential service than any other service. Like a restaurant. To me, that's more important, to have somebody to talk to. And being in that room face to face is very powerful. We've all been there at some point in our lives, and I think it's a great credit to your particular profession, and to you as a professional. Working with you has been an honor, and it's been fascinating to say the least, learning from you. And I hope that you can come back and tell us a little bit more about what you see as these outcomes start happening, like maybe in a month where you're opening up your practice and people are starting to come and divulge more about what's happening to them and their life. So I thank you so much, Chris. I really appreciate your time, and I know that you've got to go and see patients now. So
yes.
I please, will you come back and talk to us again?
Yeah, if you could add text, it'll say "to be continued."
To be continued. Yay! Thank you so much, Chris.
Thank you. Thank you.